So the ACL is one of the primary stabilizers in the knee. There's four. The ACL, which stands for anterior cruciate ligament. Then the PCL sits behind it, and then there's two hinge ligaments, which are called the collateral. But yes, it's in the knee joint.
It's probably the most feared injury of an athlete.
No doubt it's a very devastating injury, right? Because it usually is not career-ending, but definitely season-ending. If you tear your ACL, there's a period of kind of rest and rehab before the surgical treatment. And then it's usually 6 months to get back to training in your sport, and probably 9 to 12 to be fully recovered.
If they've diagnosed that you do have an ACL tear, what is the next step?
If you tear your ACL, you generally have two options in regards to treatment. You can treat this surgically with what we call a reconstruction, where we rebuild the ACL, or you can treat it non-operatively with bracing and therapy.
What are the chances of a person like me who plays soccer actually getting an ACL tear?
There are about 500,000 ACL tears a year in the United States. The incidence of tears for sports is different. Sports such as soccer, football, basketball, downhill skiing, those are the high-risk sports that have a higher number of tears per what we call athletic hour.
How does one tear their ACL?
Right, so the ACL is torn in two ways. There's either a contact injury where it's two players forcing the knee into an abnormal position, or actually most ACLs are torn in a non-contact position. The knee or the foot is usually planted, and there's two mechanisms, but one, the knee can go into hyperextension, which is beyond straight, and then the other mechanism the ACL tears is the foot is planted and the body is forced into an abnormal position, causing the knee to twist, if you will. So hyperextension and twisting are the two mechanisms that tear an ACL.
So on that point, do you think turf versus grass, there's a difference within ACL tears?
That's the million-dollar question. Studies are different, right? So some say turf, some say grass. I think the key is, as I described the mechanism, it's that foot plant. So if the foot stays planted to the ground and there's a mechanism that twists or causes the knee to go straight, you're more prone to tear your ACL. So it has a lot to do with the surface, but also shoe wear.